Hello everyone, my name is Sarah Albuquerque, and today I'm going to be discussing why vitamin E in vape flavors may cause lung illnesses. So before I get started, I want to familiarize ourselves with what vitamin E is. So this alpha-tocopherol acetate, or vitamin E acetate, is an oily substance that you may be able to find in dietary foods, in cosmetic products, skin products, and many other products that are helpful for us. Now, vitamin E can also be helpful with medical conditions such as Alzheimer's disease, such as certain blood disorders, and also menstrual cramp pain. Now, we discussed how vitamin E may be helpful for us, and you may be wondering, okay, well, since we talked about everything that vitamin E is beneficial for us, how is this harming us? How is this harming people? So a phenomenon that's been popular all around and is still very popular and is still growing is something known as vaping. So vaping started with e-cigarettes that mimic regular cigarettes. So people were trying to quit smoking. People were trying to get other people to quit smoking. And they basically created this idea of vapes. So as these vapes advanced, they started to become larger and they started to become rechargeable. And what these vapes include were cartridges. These cartridges were filled with liquids and is heated and is eventually passed through an atomizer. This atomizer causes the liquid to become vapor, or it vaporizes the liquid. And that's why they call these vapes. So how does vitamin E come into play, okay? How is it harmful, okay? So with the liquids, in order to dilute them or to thicken the liquid, they added the vitamin E acetate into those liquids that are in these vape flavors. Now I want to talk about anatomical regions and procedures used by researchers to further understand why vitamin E was harming people. So here I have a diagram of the lungs. It's not the best drawing, but it just kind of gives you a visual of what we are talking about. We have the trachea, we have the bronchioles, we have the bronchi, we have the pharynx and the larynx. And basically, I kind of just want to talk about how researchers, came about this idea and how they understood that vitamin E acetate was the problem. So researchers used a technique called a bronchiovelar lavage. And basically what this is it's a fiber optic camera in which they inserted down the trachea, the respiratory pathways, down the trachea and down the bronchial trees. So this is basically the bronchi, and these are the bronchioles that consists of air sacs, or they consist of small branched out air sacs. So basically with this camera, they were able to find out what's going on, what's causing this in patients, and why are all patients getting hospitalized after knowing that they've been vaping. So with that being said, they also injected a saline, and the saline was composed of salt water. The salt water, the saline, and all the fluid that's kind of surrounding the lungs were sucked out and analyzed. And they analyzed what was going on. Why was this harming people? So after many people were hospitalized after people were, coming up with symptoms. They were, having so many symptoms that are similar to inflammation. They kind of matched it to a disease called pneumonia. Now, I don't want to really go into specific details about pneumonia, but I just want you to know that pneumonia is basically inflammation of the lungs from liquid surrounding the lungs. So the symptoms that occurred with people that had, this inflammation were fevers, chills, icky feelings, coughing, shortness of breath, chest pain, and sometimes hemoptysis, which is coughing blood. So vaping is basically causing an increase in the fluid surrounding the lungs, which is essentially causing inflammation in the lungs. The vitamin E acetate is burning the fragile part of the layers. So these layers that are right here in the lungs are being burnt from this vitamin E. These layers of our lungs are very fragile and they should be taken care of. We only have 2 of these organs. So basically, the layers of the lungs, the vitamin E acetate is burning the fragile part of the layers of the lungs. When oxygen enters the bloodstream, causing the oxygen level in patients to drop, which became known as e-cigarette or vaping product use association lung injury. So basically, when vitamin E is used as food that goes down our esophagus, and when it's used on our skin, it's beneficial, it's helpful for us. But when does this product become, or this oily substance become harmful, is when we inhale it. So the difference between vitamin E going into our esophagus and on our skin is a huge difference than when it goes down our pharynx or the back of the throat, or where air goes through our lungs. So the inhalation of this oily substance was causing an inflammation in the lungs and causing people to have shortness of breath and an increase of liquids around the lungs, causing a reduction of oxygen. So how can we relate this to chemistry? So first of all, we talked about the dilution of the liquid. We talked about the heating of the liquid in vapes. And we also talked about the oxygen that's being reduced after this product is being inhaled. So the dilution of the chemical causing a thickening of the oil and added to vape flavors of these vape cigarettes is where we can connect this to chemistry. Okay, well, when we think about what we talked about in chemistry, the dilution of liquids and what's going on, how can we get a different result than what we had at first, was by doubling it or diluting it, or also in this case thickening the product. The formula of vitamin E acetate is C31H52O3. The heating of the liquid in vapes, causing a vaporizing result, is also another way we can talk about or relate this to chemistry. And last but not least, the relation of oxygen when we are inhaling the oxygen and exhaling carbon dioxide. So when we use the vitamin E acetate, the reduction of oxygen is caused by the inflammation of the lungs from the vitamin E acetate, which causes shortness of breath and many of the other symptoms that we talked about earlier. So this concludes my overall topic about how vitamin E acetate can be a bad thing, or can be a harmful thing in vapes. So if you do vape, and if you find it an essential need, because we know that nicotine that's in these vapes relaxes the muscle, and that's why people, they tend to smoke, they tend to find it, it kind of puts your mind off of things because it relaxes the muscles. So if you do find a need to vape, make sure that you are not getting any vape products that include this vitamin E acetate that may cause pneumonia or any other illnesses. Thank you so much for watching, and I hope you guys found this helpful and educational.